Hello, everyone. My name is Jordan Perlman, and I'm the Program Manager of the Transplant Center here at CHOP. I want to thank everyone for coming to our second session in the Transplant Transition series. We hope you were able to join us for our first session of the webinar series that highlighted the importance of transition readiness for the transplant patient. If you were not able to join us, a video of the first 3 sessions will be posted on the transplant section of CHOP's website at the end of the series, so they'll be available for everybody. We're so happy you decided to join us today and hope that you'll be able to join us for the rest of the webinars in this series as well. And we can move to our next slide. For here, we have the remaining webinar session dates and topics. We'll be sending reminder emails and MyChop messages with links to register for those as the dates get closer. I just wanted to go over a few reminders before we get started. We will have time at the end for questions. We will answer some of the questions that were submitted ahead of time. But if you have additional questions, please use the Q&A feature that you see in the sidebar. Again, this session will be recorded to share with other patients, families, and providers after the fact, but none of your questions or your names will be visible. Because this is a Blue Jeans event, attendees' mics and video are muted. There will be an opportunity for patients, parents, and providers to interact in the last webinar of our series in July. Today, I want to introduce Jill Plavinsky and Natalie Stalin. Jill Plavinsky is a psychologist here at CHOP in the Transplant Center and the Department of Child and Adolescent Psychiatry and Behavioral Sciences. She works primarily with the liver and lung transplant programs and has expertise in adherence and self-management, adjustment to having a chronic medical condition, and transition to adult care. Natalie Stalin is the Assistant Director for the LEND Community Collaboration, Clinical Program Manager for the CHOP Career Path Program, and a social worker in the Adult Care and Transition Team, ACTT, here at CHOP. Thank you so much, Jill and Natalie, for joining us today to discuss psychology and social work perspectives on transition of care. We'll start by having Jill present psychology perspectives.
Great, thank you. Hi, everyone. I am going to share my screen. There we are. So hello and welcome. Thank you so much for having me. I'm really excited to be presenting to you today. As Jordan mentioned, my name is Dr. Jill Plavinsky, and I'm a transplant psychologist in the Pediatric Transplant Center here at CHOP. And I work primarily with the liver and lung teams. But there is a larger Pediatric Transplant Center psychosocial team that I would be remiss to not introduce to you all, although many of you may have come into contact with us over the years. But we do have 4 organ programs here at CHOP: heart transplant, kidney, liver, and lung. And the psychologist for the heart and kidney transplant program is Deborah Lefkowitz, and then myself for liver and lung. And then we also have wonderful social workers that are part of our psychosocial team. This is Charisse Rohn, who works with the heart transplant program. Emily Bram works with the kidney transplant program. Mesna Gulamali works with liver transplant. And then there's Debbie McGrath, who works with lung. And so I wanted to start off by talking a little bit about what a pediatric psychologist is, which is my role in the Transplant Center and Deborah Lefkowitz's role as well. So pediatric psychology is a field of research and practice that addresses the psychological aspects of illness and injury and the promotion of health behaviors in children, adolescents, and families in a pediatric healthcare setting. Since we know that there are both medical and psychological complexities to transplant, including the crucial need for lifelong medication adherence and medical follow-up, it's often important that your behavioral health providers have clinical skill and scientific knowledge specific to pediatric transplant. So Dr. Lefkowitz and I, like I said, are both pediatric psychologists, and we know that no child exists in a vacuum. And so when we think about psychological issues, we think about these issues in the context of a child's development and their relationships between children and their families, as well as their school, social environments, and the healthcare system as a whole. And so there are a wide variety of psychosocial needs in pediatric solid organ transplant? This was actually a question that came up in our previous session that I wanted to address briefly today. We do know that, patient and parent caregiver mental health issues come up at every point along the transplant process. Some common issues are anxiety, post-traumatic stress, and depression. And these are all things that can be addressed by a pediatric transplant psychologist. We also know that school and social issues can come up, including issues related to school reentry or bullying, and neurocognitive difficulties can be challenging as well. These can include attention and memory difficulties, language development, visual spatial skills, and last, which is what I'd like to focus most of my presentation on today, is adherence and self-management. And when we think about adherence, we think about adherence as defined as the extent to which you're able to follow your medical team's recommendations outside of the doctor's office. We know that the time you spend here at CHOP or in the doctor's office is a tiny percent of your life compared to the time you spend outside of the hospital, living your life at home and at school and with your friends. And so we want to promote adherence outside the doctor's office in your day-to-day life, as well as self-management. And we think about this as a gradual increase of responsibility for healthcare, and we think about it as part of the ongoing transition to adulthood. Many children who've had solid organ transplant, especially at an early age, report difficulties with all of these kind of aspects of life, and they can come up at any point during the transplant process. And we want you to know that your psychosocial team is here to support you with all of these issues. To shift to the focus of the presentation, self-management in pediatric solid organ transplant is really complex. These are just examples of a few of the things that you all have to do on a daily, weekly, monthly basis to make sure that you're staying on top of your health and keeping yourself in the best health possible. Solid organ transplant is a life-saving procedure, but it also marks the start of a lifelong chronic medical condition. And so the post-transplant regimen is really important and really complex. And I recognize that this is definitely not a complete list of all the things you have to do to manage your transplant. And every patient has a different combination of these tasks and different frequencies at which they need to complete these tasks. And it really depends on your individual treatment plan with your medical team. And really, the point I wanted to make with this slide is that managing a chronic medical condition is more than just taking your medications. There's a lot that goes on outside of the day-to-day treatment that contributes to your adherence and self-management broadly. This is the pediatric self-management model. This is a diagram that is a little intricate, but really it's how pediatric psychologists think about self-management. So we know that there are individual, which is in blue, family, which is in yellow, community in orange, and healthcare system in green. All of these types of factors contribute to self-management behaviors. And each category has both modifiable or changeable influences and non-modifiable or things that can't be changed influences. And we believe that all four of these contexts really influence how someone is able to adhere to their treatment regimen and be good at managing their transplant condition. And so variety of treatments, of course, as mentioned before in that middle column, can come up in different combinations. I like this model because it also mentions lifestyle modifications, which you'll see at the center of the screen, including movement, nutrition, hydration, and sleep, but also clinic appointment attendance and just general symptom monitoring, recognizing how your body feels. And so when we manage these symptoms well, we know that they can lead to different outcomes. Some are individual health outcomes, right, like quality of life or healthcare utilization, and other are system-based outcomes like financial costs and how your treatment works in your body and healthcare delivery. So as psychologists, we really focus on thinking about the modifiable factors or the changeable factors that can influence your adherence and self-management to your treatment goals. So what does self-management have to do with transition? So we know that adolescence and young adulthood is a really vulnerable developmental stage. Youth in this age range are at risk for poor self-management across chronic conditions, not just in transplant. There are unique challenges to managing a chronic medical condition during this age range, part of which is because there are more transitions going on than just with your healthcare. You might be transitioning to college or a job, or you might be transitioning to a different living situation. There might be changes in your financial status, which I know social work will touch on a little bit later. And last, we know that patterns of behavior that are established in adolescence tend to persist into adulthood. So it's actually prime time for us to think about how we can set you up for success in the long term. And so that's why really promoting adherence and self-management in adolescents age 12 and up is associated with more successful transition and eventual transition to adult care. So getting ready to transfer to an adult center is a process. And I know this was talked about a little bit in the first webinar if you were able to attend. The process is called transition. And transition involves the slow, planful, gradual shift and responsibility of healthcare tasks from parents to their teenagers. And as my bullet point says, we know it's hard to let go, and it's hard for us too. It's hard for your pediatric providers to let go also. So it's not just you having those feelings. We feel attached to you too. And I think sometimes we don't always say that enough. The reason that I have this graphic of riding a bike is because I like to think about the transition and transfer process in this way. When you're first teaching your child to ride a bike, you are holding them up. You might even still have the training wheels on and you're still holding them up. Your child might feel anxious or scared or worried and not really knowing what they're doing, but trying to pedal away. Maybe their feet can't even really stay on the pedals yet. Maybe they're kind of steering all over the place, running into mailboxes. That's expected. And that's why we have you behind them, right? To support them and coach them through learning and becoming more and more confident in being able to ride that bike smoothly and confidently and independently so that at one point you can let go. So how can pediatric psychologists help? In addition to working with patients and families on kind of mood and emotional related concerns, we can also play a role in promoting self-management and transition readiness. Here are 3 commonly used techniques that we use in therapy to address these concerns. And so the first one I want to talk about is motivational interviewing. So this process builds self-efficacy through empathy and recognizing that for both parents and patients, this shift in responsibility in healthcare can be a challenge. And for those that don't know, self-efficacy is your confidence in your ability to accomplish something. So we want to promote both you as a parent and you as a patient to feel confident in your ability to take on more responsibility for your care if you're a patient, or shift that responsibility to your child if you're a parent. And the goal of the technique, like I said, is really to build this confidence. For problem-solving skills training, this approach is more structured and geared toward identifying barriers specific to transition readiness or self-management that come up within an individual, a parent, a family, or the healthcare system overall. And once we identify these barriers, we can work together to come up with ideas or strategies or different solutions that really address these barriers, and we test them out. And we work together until we find a set of strategies that work for you and your family. Sometimes barriers can be logistics, things like finding a center, navigating insurance issues, which social work can be extremely helpful with. And sometimes there are issues related to anxiety about shifting that responsibility from a parent who's been 100% responsible for their child's medical regimen and thinking about kind of giving them more of the driver's seat. So we can certainly be helpful with that too. Another strategy can be goal setting. And this is something you can do on your own. Listed are some examples of recent goals that were set by some of our adolescent post-transplant patients so that they can work on gradually increasing their involvement in their disease management and healthcare. So one patient that I met with decided to take responsibility for filling their pill case with parent oversight. So their parent had been filling their pill case for them, and they decided that they would like to start doing it, but wanted their parent to kind of check over it after they were able to do that, just to make sure that they were doing it correctly. So that's an example of that really slow, gradual shift, not just giving the child full responsibility over filling their pill case, but really thinking about gradually shifting that ownership. Another patient decided to download a medication tracking app. Prior to our meeting, the parent had only had the medication tracking app on their phone. And so now their child has that app on their phone as well, where it just lists all of their treatments and alarms for taking them and tracks when they've taken them too. And last, another patient created a recurring calendar event to remind them to get routine labs. So this was a patient who was getting labs every 3 months, and was thinking about getting their driver's license and potentially driving themselves to get their own labs. And so we thought of the idea as a reminder to get these routine labs, to set that recurring calendar invite, or calendar event, in their phones. So here are some things that you can start to do today. You can set a self-management goal. Make sure it is small and something both the parents and the child feel is manageable for them. You can start to let the patient lead their own medical visits. I would even encourage them to write down questions or concerns for the medical team, or keep a running list in their phones. The Notes app is very helpful for this. And then you might also start to think of things that might be barriers to transferring to an adult center in the future, depending on how close you are to transitioning. These are things that you can bring up at your next follow-up visit with your medical team to get ahead of some of these challenges. And I want to talk about key elements of successful transition. So our first and foremost priority is that you're not lost to follow-up. We want to make sure that you have an adult medical team in place that you feel comfortable with before we transfer you to adult care. We'd also like the first visit to an adult provider to be no later than 3 to 6 months after your last visit with us. We want to make sure you're able to attend those visits in adult care. We want you to be able to develop a trusting relationship with an adult provider. We want this attention to be continued to be paid towards self-management. We, of course, want you to be satisfied with the experience, and we want you to be able to maintain or improve your health. And I wanted to conclude with just some ongoing program development that's going on within the Transplant Center here at CHOP. So the heart transplant program has started some multidisciplinary clinics, which include meeting with the medical team as well as psychology and social work. The kidney transplant program already has a multidisciplinary teen clinic, including psychology, social work, and pharmacy. The liver transplant program has annual post-transplant psychosocial visits with psychology and social work. These are for adolescents 12+. And the lung transplant program has post-transplant psychosocial visits with psychology and social work at 6, 12, 18, and 24 months, and annually thereafter for adolescents 12+. And the goal of these visits is to not only check on your mood and emotional functioning and overall psychological functioning, but to promote self-management in the service of getting ready to transition to adult care. So here's how to access transplant psychology at CHOP. For heart and kidney patients, you can always contact Deborah Lefkowitz. Her phone number is listed right there, or you can always reach out to your medical teams. And then for liver and lung transplant patients, my phone number is listed. And again, you can please reach out to your medical teams if you would ever like to get in contact with us or set up an appointment. I have some links about where to learn more. These will be sent out to you, so don't worry about copying them. I know some of them are a little bit long, but they include links to the Transplant Families website, the American Society of Transplantation Pediatric Transition Portal, the GOT Transition website, which I think was mentioned on our previous webinar, has really great resources. There's also a Society of Pediatric Psychology transition tip sheet for patients and families that you can download from this link, which again will be sent to you later. And then there's also the CHOP transition to adulthood services for the whole hospital, which I'm sure Natalie will be talking a little bit more about in her presentation. So I wanted to thank you all for your time. I believe we'll shift to Natalie's presentation and then have time for questions at the end. So thank you.
Okay, can you hear me? I know no one can really answer, but
we can hear you.
Okay, perfect. And just give me 1 second to share my slides. Okay. And oh, oops, that's not even the first slide. Okay. And can one of my colleagues just confirm that you can see the slides?
We can see the slides in full screen.
Awesome. Okay. Well, hello, everyone. I am so happy to be here with you today. My name is Natalie. I am one of the social workers in the adult care and transition team, and we are actually a team that sees patients from all across CHOP. So we might see some of you, but we can't see every patient that is transitioning to adult care. So usually we see patients that might have many different specialists from all different parts in the hospital, but your main care is with your transplant team and maybe one other doctor. Then your team is doing such an awesome job of helping you to transition. I just wanted to tell you kind of what we do. I work with a wonderful team. I just came from clinic now, and I like to tell our patients and families we are I think the only people at CHOP that really only work with adults. And I am also one of the program managers for the CHOP Career Path program, which is an employment program for youth and young adults that have any type of chronic illness or disability. And so I love talking about employment, and so you'll hear a little bit more about that soon. So I know you've probably heard lots about healthcare transition. This is what it is, and it's one of, I think the thing to highlight is one of many transitions that might be happening for you at this point. So some other transitions might be graduating from high school, starting college or trade school, starting a first job, living away from your parents or guardians. So lots of stuff is going on, and although healthcare is obviously very important, the reason that we all want to help you and your medical teams want to help you stay healthy is so that you can enjoy all of these other great parts of life. So I want to talk a little bit about some of the other pieces that might shift around. So I know Bill talked a little bit about this, but things, and we think about things that your provider can do, so to help you set goals, things that you can do, and things that your parents or caregiver can do. So some things like speaking up during visits, knowing where to keep your medical information, learning how to schedule those appointments, and one of the most important things is what to do in case of an emergency. Because especially as a teenager or young adult, you might be spending more time away from home, just out with friends. And so where is your information in case there is an emergency, and who from your support group, maybe friends or partner, needs to know what to do in case of an emergency, and how do you have that conversation? And I know sometimes folks have not had to have that conversation before because everyone who knew them when they were little, they obviously knew what to do. But as you're making new friends, and that's something to learn how to practice. And then for parents and caregivers, can really help you with practicing some of these things and doing things like
calling together to make appointments can be really helpful. I know many people nowadays don't love being on the phone, but unfortunately most appointments still need to be scheduled by phone. So, getting used to what you say when you're on the phone can be really helpful. Other things that change, when you turn 18, as you probably know, some things change from a legal perspective. So now you're in charge of your own healthcare. Your medical team is going to be looking to you. I know there were some questions sent in ahead of time. Someone I think was wondering if their parent would still be able to come to their appointments, and absolutely yes. There's no one is going to stop your parents from coming to your appointments. I think it's more that you are going to be, really in the driver's seat, and probably your provider will want to be, or your provider will want to be talking to you alone for at least a part of the visit. But whoever is your support person, if it's a family member, friend, caregiver, partner, they should be always welcome at appointments, except in COVID times when there are other restrictions, but that's different. So medical decision making, you call the shots, right? You're going to be asked to sign those release forms. When you think about who do you want to have access to your medical information, you actually, sorry, parents and caregivers on the phone, but you can actually say that you don't want your parents to have, access to some parts or all parts of your medical information. Hopefully, if there's support to you, that won't happen. But you do have that right to have privacy and to not be giving everyone access to your information. And if you are having a surgery or a procedure, or you're inpatient, you may be asked about advance directives. So what do you want to happen for you if something goes wrong, or what do you want that to look like? And those are conversations to have with your trusted family members and medical team, but there are questions that might come up. Other questions everyone always wants to know about. Everyone always hates to know about insurance, but also wants to know about insurance. So one of the things, if you have private health insurance, you can still stay on if you have private health insurance through your parents' health insurance, you can still stay on it up to the age of 26. Sometimes, and this is very specific, and parents and caregivers, I usually recommend that you talk to your employer if you're wondering about this. Some adults with quite severe disabilities have been allowed to stay on private insurance longer into adulthood. It usually really depends on multiple factors, but specifically the employer. So something to ask HR about if you're wondering. Medicaid, if you have a Medicaid or public insurance, so like Keystone First or Aetna Better Health or United Healthcare Community or Health Partners, those are just some examples. There are certain services that end at age 21, and we'll talk about that a little bit on the next slide. And you also, I know someone was worried about if their Medicaid could continue after 18. So your Medicaid might be reevaluated when you turn 19. It's like through your 18th year, and it, depending on how this is a little more complicated, but depending on how you were classified for getting Medicaid before, it could get turned off, but you should be eligible to reapply and get Medicaid pretty quickly and easily, as long as your income is still under the income limits and based on having a chronic health diagnosis. So unless you're making lots and lots of money and you have your private health insurance through a new job that you got, which would be awesome, you should still be eligible for Medicaid. You just may need to reapply. Another thing, so this is a little bit, don't have to remember all the letters, but EPSDT, that's just fancy for saying that there's certain services that children and young adults up to the age of 21 can get, and sometimes that is skilled nursing at home or a home health aide. And so some folks may have that, people coming to your house to help out. And so just to know that the way that gets funding changes when you turn 21. And so that doesn't get funded through your Medicaid health insurance anymore. And it needs to be funded in a different way. And we're going to talk a little bit about what are some of those ways. And also something to just be aware of, and I know your medical teams are going to help you think about this and plan for this, but sometimes CHOP, which, maybe where you get your medical care now, takes different health insurances than the adult hospital that you may want to go to, or so it's just something to think about as you're planning which adult hospital you'll want to go to. But that's something that, I know here at CHOP, we can really help support that and make sure that you're aware of which insurance is accepted where. Other changes. So supplemental security income, or SSI. So some people might be getting SSI now as a child. As a child who's under 18. So just be aware that before you turn 18, so usually about 3 months before, they send what is called a redetermination letter. So they want to look again to see, are you still considered to have a disability under the criteria for Social Security. And so they'll ask for more medical information, if you have any therapists or behavioral health information. So the most important thing is to make sure that you don't miss that letter, and that Social Security has the right address for you, so you get the letter, and that you send all the information that they're asking. Sometimes the way that they determine disability is a little bit different for children than it is for adults. So some people may not continue to be eligible to get SSI, but the only way to know is to make sure that you're providing all the documentation that you can to really show your chronic health condition. And the reverse is some people were not able to get SSI when they were children, because SSI when you're a child is looking at your whole family's income. And so if your family makes more money than is allowable, then you would not be eligible. But once you turn 18, it's only looking at your income. So your income as an 18-year-old is probably much less than your whole family. So you may be eligible for SSI at that point, and you could apply for it when you turn 18. This is something that we call the Transition Readiness Assessment Questionnaire. And I know Jill was talking all about different goals that you might have, different ways, the ways to really improve your self-management. And this is a really good tool that you might want to use to do that. And you can, it's pretty easy to Google, and we can actually send out a copy of it with the resources at the end, I believe. Hopefully Jordan or John will allow for that. But it really asks a lot of pretty relevant questions about your own medical care, and it gives you a way to assess it, right? So do you know how to fill a prescription on your own if you need to? So you might not know how, you might not know how, but you want to learn. You might be starting to learn. You might be learning to do this. You might have already started doing this, or you might always do it, right? And if you can use this to assess yourself, then you might really see where some good goals would be. So that's a really good resource that we like. And then as we talk about goals, we like to talk about something that we call SMART goals. And so that's specific, measurable, achievable, realistic, and time bound. Because a lot of times if we just say that our goal is to get better at taking care of our health, how am I going to know if I achieve that, right? What is it that's going to tell me? And also that can kind of seem a bit overwhelming, because there are so many things that to do in order to take good care of yourself, right? So it's a lot easier if you break it down. So some examples: just learning more about your health condition, taking on more of your healthcare, which we've talked about, speaking up for yourself, and that doesn't just mean in your doctor's appointments, but also at school and at work and in your future planning. So these few slides were actually put together by one of my colleagues who is actually works at CHOP in a different role now, but at the time she was our community health worker for our team, and she actually herself was a CHOP patient and transitioned to adult healthcare. So she put these together for us, and we're very grateful for her for coming up with these examples. But really some nice concrete examples of things that you should know. So a diagnosis, what is your actual diagnosis? What is some of the medical history? What are some important dates of surgeries or years or things like that you should know? What are your allergies? What are the names of your medications? And then again, remember that emergency care plan. Now, I know sometimes this is a lot of information, especially it can be a lot to remember. I always tell patients and families that you don't need to remember all of it. If you do, that's great. Some people have a good memory, and that's it's easy for them to remember. But you just need to know where you can find that information. So if you keep if you keep a screenshot on your phone, if you keep stuff in notes on your phone, if you save pictures of documents that are important to you, always remember to keep your health information safe and protected with passwords and a passcode. But think about what strategies are helppful for you in terms of knowing this information, and don't feel like it all has to get stored in your head. Some people like paper, keeping a folder or a binder of medical papers, practicing explaining what your diagnosis or your medical history is to your family or friends. And like I said, saving that information in your phone and carrying an insurance card. I know a lot of times parents or caregivers keep that insurance card because we don't want anyone to lose it. But if you can request an additional copy from the insurance company, which they should give you, that's really something good for a young person to be carrying around just in case, especially if you're out and about. Taking care of yourself. I know Jill really talked a lot about this, so I'm not going to go into it, but remembering those medications, refilling medications, tracking symptoms and side effects of medications is key part of healthcare. And then speaking up for yourself, and a lot of times this can feel overwhelming, I think. So your healthcare providers are going to want you to be able to answer questions. And yeah, sometimes you can ask for help from family members or caregivers, but really starting to come up with your own questions and making that list ahead of time, and practicing talking to your provider so that it doesn't feel as scary as it might. And then that the phone call thing, this is she wrote this, my colleague, that specifically she would always help our young patients write out what they wanted to say on there before they made a phone call, because otherwise sometimes you forget what you want to say when you get on the phone. And then this is what I always like to focus on. Like I said, planning for the future. What's all that fun stuff, right? All those good life goals, finishing up high school and, staying healthy so that you can really do whatever it is that you want to do. And talk to folks about that. Talk to your healthcare providers, talk to your school team. And if you have an IEP, which is an individualized education program, participate in those IEP meetings because they're really all about you. Where do you even start, right? Like, what do I want to be when I grow up? So talking about career goals, talking about them when you're young, talking about them as you get older. A lot of times our career goals change, and that's okay. But really talking about them with all the folks in your life that are important to you. Career exposure. So a lot of times there's jobs that we never even knew existed. And the way to get that exposure is to be able to see and get experiences of as many types of jobs as possible. So there's something called job shadow. So that's just basically where you follow someone around to see what exactly it is that they do. And this is something that you could do just, informally by asking, friends or family members who have a career that is of interest to you, if it would be possible to shadow them. And also a resource that we're going to talk about, OVR, the Office of Vocational Rehabilitation, can help folks in high school with connecting with job shadowing, so to really be able to learn more about their, some things that might be of interest to them. Have conversations, just get that more information. If you are able to have a part-time job, even if it's in the summer, that can really help you get a sense of things that you might love doing and things that you might hate doing. If there's opportunities for in-school work experiences, internships, other types of things like that, that could be an option, and also volunteering. And like I said, those goals can change as you start to, see more things and kind of learn more about yourself. We do know that some folks are going to be going on to college as well. And we always like to tell our young adults that if you have any type of chronic health condition, you should find out about the Office of Disabilities at your college. I know sometimes if you have a chronic health condition like a transplant, you may not consider yourself to have a disability, and that's totally fine. That's just the words that they use in colleges. And so and you have to actually identify that. So in high school, they might just, let you take breaks or do other stuff just because they already know you. Maybe they've known you for a long time. But in college, the way to get those accommodations is to get connected to the Office of Disabilities and to make sure that, that's set up in place. So things like extra time on tests or having a note taker or taking, test taking in a quiet area, even, access to water or being able to use the restroom frequently if that's what you need, and not getting, and not having that take up time in your test. So if you go to the restroom for 5 minutes, you add on 5 more minutes to your testing time. This isn't changing your coursework in college, but it is, it's just making it fair and equitable for you to participate and make sure that you're able to do that. And I do also tell folks, who have a chronic health condition, that even if you don't need any of these things, even if you don't need any extra notes, any testing in a quiet area, it is really helpful to just get yourself registered and connected with the Office of Disabilities, because just in case you had a health crisis and you needed to miss a lot of class or you needed to miss a test or whatever, it's a lot easier if you're already known to the Office of Disabilities and they can send your professor a letter to say, oh yes, we knew that this person had a chronic health condition, they need to be able to miss class because of X, Y, and Z. It's a lot easier to do that in advance when you're feeling healthy and feeling good than it is to do it after the fact, or if you're in the hospital, to really try to be scrambling to do that. So recommendation, even if you don't feel like you need any accommodation. And then the same thing really goes for work. So the Americans with Disabilities Act, you may know it again. Disability may not be a word that you feel like fits you, but really the goal of this is to make sure that you have all the accommodations in order to be successful at your job. And so similar types of accommodations that are, than college accommodations, making sure that you have enough time for breaks. If you need an extra break during the day, to make sure you take your medications at the right time. I have a colleague who is a nurse actually at CHOP, and she has a transplant, and so she's immunocompromised, and she in the particular floor that she worked on, there were not very many patients that had infectious diseases, but her accommodation was that if there was if there was a patient on that floor, she actually didn't work with that patient. She just worked with patients that had other needs. So that was a reasonable accommodation, that she didn't work with patients that could be more likely to get her sick. And then for some people, a little bit more support can be really helpful for employment. So we have something called supported employment, and that's really to help people who are wanting to get a job but need some help with applying, creating resumes, and even getting used to the job. Learning job tasks, making sure, if it's hard to talk to a supervisor, really making sure that you learn how to do that. So that's what we call supported employment. Vocational rehabilitation, and there's one in every state, and I have some links at the end, one for Pennsylvania, one for New Jersey. And if you're from a different state, you should just Google your state and vocational rehabilitation. It shouldn't be hard to find. And so this is a service that helps folks with any type of chronic illness or disability that might make it difficult for them to work, with getting ready for work, getting a job, and keeping their job. And basically, you would first become eligible through through connecting with the Office of Vocational Rehabilitation in your county, and then they would help you connect with a provider that can really help you. And I mentioned at the beginning, I'm one of the managers for CHOP Career Path, and so we work with vocational rehabilitation on this, and we have folks at CHOP who are doing this work. And this is a really awesome service. I love it so much. It is time limited, so it really is there to help you figure out what job you want, get a job, get settled in, and then, usually then the support phases out. But it can be really, really helpful. These are just some examples of things that vocational rehabilitation can help with. And then some other things to know. So for some folks that may continue to need support in different things like jobs, or if you heard me say at the beginning, if you're getting nursing care or home health aides and you need to continue to get that, you might be eligible for a waiver. And this is something that I would recommend you talk to your social worker about in your clinic, because you'll want to be able to get as much information as you can. But this is something where you're going to register through your county for the waiver that you are eligible for. So if you have a diagnosis of an intellectual disability, you would be eligible definitely for a few different waivers. And if you need ongoing nursing care, then you would also, but no intellectual disability, you could also be eligible for a waiver. These are just some examples. You may or may not have heard of them. And so the Office of Developmental Programs is for someone that has autism or an intellectual disability. You could be eligible for any of these waivers. And the Office of Long-Term Living, if you're more, needing more medical, like nursing, things like that, but you don't have any learning needs, and these would be more of a fit for you. And then in New Jersey, similarly, we have the Division of Developmental Disabilities that also offers waiver support. These are just some of the examples of, there's lots of different services that you can get through a waiver. It's really awesome. If you've been getting a lot of support in high school and you're staying in high school until 21, then these are then this is the service that is really going to help with all the kinds of supports that you would need after you graduate from high school. And these are a couple of resources. I want to highlight the Ask Jan for reasonable accommodations. It's really kind of cool. Like, you can type in your diagnosis and it can give you some examples of accommodations that might be helpful for you. And then the vocational rehabilitation and waivers that I talked about, some links there for Pennsylvania and New Jersey. And that's about it. Hold on. Now I have to unshare.
Fantastic. Thank you so much, everyone. So Dr. Plavinsky, Natalie, great presentations. So I'm John Savan. I'm a physician assistant with the kidney transplant team here at CHOP, and also part of the transition working group working on these transition to adult care issues. So thanks everyone for joining today. We do have some time here for some questions and answers. A lot of questions were submitted in advance that we could go through, but I'll remind people that are on right now, you can click the Q&A button on the right-hand side of your Blue Dream screen if you want to type in a question that we can get addressed by these experts of their craft and their field here. All right, so while we wait for some more questions to go in, let's address a couple. So Natalie, you addressed a couple that had been submitted in advance already, so I'm going to check those off the list. Thank you very much. But here's a good one. It's a complex one, and this is open for both speakers. First one would be, if the adolescent is not ready to transition to adult care, emotionally or cognitively, how will adult transplant centers care for them?
I can start. Oh, yeah. I just wanted to also say, and I think Natalie touched on this a little bit, but I think that transition does not stop when you transfer to adult care. It kind of continues until the patient is, independent in their ability to manage their healthcare condition. And sometimes that doesn't come until after they've transferred to an adult provider. So I liked that, Natalie highlighted that if your parent, your mom, dad, or caregiver is your support person, then they absolutely, should be able to accompany you to your adult appointments and kind of help you continue that process of becoming, an independent in managing your healthcare. I think that, there are a lot of barriers to readiness that it's really nice that CHOP has not only our transplant-specific psychosocial resources with psychology and social work, but also broadly as an institution and all of the links that Natalie provided to help with the kind of the feeling of readiness, I guess, and all of those logistics that can sometimes be what is causing some of the distress around that eventual transfer. So, Natalie, if you had anything to add.
Yeah. No, I think it's so hard, especially for folks that have been with CHOP for, such a long time. And I think that there are some of our patients that they may never feel emotionally ready because they're so connected to their, the wonderful teams here at CHOP. And I think, that's really, really hard. But we do, I think we think more about, an adult body is different than a child's body, and so I think like Jill said, like it doesn't end just because you leave CHOP. You're going to keep learning about your healthcare. Some folks, continue to require support throughout their whole lives, and that's okay. But it's more about finding providers that are focused on adult bodies and can help with any adult health issues, because that is their area of expertise. And setting you up with all those, all the community resources that can help to support you as you, continue to become, continue to develop.
Yeah, absolutely. Like as providers here at CHOP, we would love to hold on to our patients forever, but it becomes a disservice to them at some point when the experts in adult physiology and pathophysiology can become involved and look out for adult diseases and things like that, and also allowing the patient to grow and develop on their own right, and that stay at a children's hospital. Yeah. Good, thanks for that. And I also want to reiterate a throwback to last month's first session, Dr. Vittorio, the mantra of transition is a process and not an event. As Dr. Plavinsky said earlier on, all the initiatives that CHOP has to help prepare patients for the eventual transfer of care. This transition process is something that we work towards starting 12, 13, 14 years of age. So thank you for addressing that. No new questions coming in, so let's move on to another one that was posted beforehand. Here's one. How do we help those with the developmental disability understand self-management and the importance of medical management on their level on their terms, speaking their language.
Yeah, no, I think that's something that we see many patients with developmental disabilities, and I think we always like to encourage our patients to be as independent as possible, but also have all of the right supports. And so for some folks, they may not be able to remember every single medication, or may not be able to take the medications on their own, but they may remind parents or remind their caregiver or support person, or they may be able to just list their diagnosis. And so the more skills that we can help folks learn, the better. And that's why some of the resources that I shared are so helpful, because we know that parents and caregivers may not be able to do this forever, but there are supports to really help our young adults and then adults with that medical management, even if they can't take it fully on themselves.
Yeah, I would add that, when working with patients and families to promote self-management, we always take into account their developmental status and their abilities. And like I mentioned, the important part is that both the patient feels comfortable with the amount of responsibility or knowledge that they are, planning to gain. And then parents, on the other hand, or caregivers, are also comfortable with the amount of responsibility that they're shifting and the information that they're shifting to their child.
Great. I think we got time for one or two more. One quick announcement. I did post in the question and answer. There's a red cap survey. We'll email that to you, all the attendings later, to provide feedback on the session today. But you can click on it in the Q&A or copy and paste it into your browser. One question that was posted for this session was how to discuss whether or not patients will be able to have kids. We're not going to address that now. I'm going to plug it next month. We're having adolescent medicine, a great doctor at CHOP, come and talk to us about family planning, risk behavior things, and many other topics, including that one. So tune in next month for that one. And I'll let both of you have a final word, and maybe you can meditate on this final question. How can providers help psychology and social work facilitate transition? So we talk a lot to families. This is for families, but there are providers on here as well. So we can meditate on that, and then we can close out the session.
Yeah, I think that's a great question, and I think that the goal setting piece is something that providers can be very helpful with, especially because they have the intricate knowledge of the family's history with transplant and also their treatment regimen, and often they have the most touch points with the patient over time. And so I think that offers an opportunity to enforce those goals in a developmentally appropriate way, and allow patients to, start to answer questions for themselves and lead their own visits. And I know this is something that a lot of our transplant center providers are already thinking about and doing consciously with some of our older patients. But I think that is certainly a really great first step, just recognizing where the skill deficits are and thinking about helping their patients and families promote those.
Yeah, no, I think Jill said it really well, and just I think that we all work together as part of a medical team, and making sure that patients and families are aware of things that they should be working on, and then that the psychosocial team can help to support that, and then it kind of gets supported in all parts of the visit.
Well, on that note, brings us to the 6 o'clock hour. Thanks for everyone for joining. Thanks Dr. Blavinsky and Natalie for donating their time and expertise to this important topic. And we look forward to next month for adolescent medicine and pharmacy perspectives on transition. Thank you, everyone.
Thank you.